Hi, my name is Robert. I'm a registered nurse, and this is a continuation of what to place on the envelope that's going to hold your loved one's medical history papers, things you'd want paramedics and fire rescue to see instantly. As we continue to go down the left-hand column, the next thing to write is code status, followed by a colon. We are all considered what's called a full code. Means all life-saving measures will be taken to save our lives in an emergent situation unless we have a legalized document stating otherwise. If your loved one wants all life-saving measures to be taken during a life-threatening event, then write full code so there is no confusion. If they choose otherwise, a more modern term to use to indicate end of life can be what's called allow natural death, or you may know it as DNR, do not resuscitate, or DNAR, which is do not attempt resuscitation. If your loved one does not want all life-saving measures, options to write can be allow natural death, DNR, DNAR, or a different acceptable term known. But if DNR and DNAR is chosen, I would recommend to write those out completely instead of abbreviating. The most important part, though, and what I would recommend highly to include underneath in parentheses, is to write C, legalized document, inside envelope. The reason being is that if paramedics and fire rescue see this stated on the front, they'll know that your loved one's end-of-life papers are inside the envelope and your loved one's wishes will be followed. To obtain an end-of-life paper, that can be done with your loved one's primary doctor, or in some states, if so allowed, a nurse practitioner. Sometimes a loved one will move from the state they live in to a different state as a way to be closer to family members who will take care of them. If this occurs, I would recommend, if they have one, to update their end-of-life paper to the state they're now living in, since not all end-of-life papers are universal or are honored between states. If one was recently completed, I would recommend perhaps to call the hospital that your loved one might already have an established connection with. You'd want to ask to speak with their medical records department to see if your loved one's primary doctor or yourself would be able to send over a copy to be added to their medical records file. That way, if your loved one happens to return to that particular hospital, it will already be on file and one less thing to worry about. Lastly, related to the subject, there have been times a family member, in a smug tone, has told me straight out that their loved one already has an end-of-life paper. That's okay, fine. But the question I usually want to ask is, have you seen it? Do you know where it's kept? Have you actually held it in your hands? Because I'm sure someone, while holding it, will be that person who will discover that 1, it's not filled out correctly, 2, not at all, or 3, not even an end-of-life paper, but perhaps an advance directive. An advance directive, which is different from an end-of-life paper, is a general heading for 2 parts, called a living will and a healthcare durable power of attorney, also known as a healthcare proxy. A living will is where your loved one, while not in a code situation, has stated prior that if they become incapacitated, such as being in a coma, they have chosen refusal of certain life-sustaining measures. Examples could be not to be placed on a ventilator or have a feeding tube inserted. A healthcare durable power of attorney, again known as a healthcare proxy, is a person your loved one has chosen to make healthcare decisions for them if they can't do so themselves. In most cases, a living will and healthcare durable power of attorney, healthcare proxy, will not require your loved one's primary doctor to complete these forms, with some states not requiring them to be notarized. But I would still recommend to do so as to add to their validity and authenticity. In certain past hospitals I worked in, it was a case manager or chaplain who helped, provided, and went over these forms. If your loved one has one or both of these documents, I would recommend to add these to their medical history envelope. For further information, check with your loved one's primary doctor or hospital that they already have an established association with on how to proceed. Once completed, in addition, I would recommend again for you to call the medical records department of that hospital to have these added to your loved one's medical history files. Returning now, going down the left-hand side, write the word preferred hospital, followed by a colon. You'll want to write the hospital's name and its full address. The reason being where a hospital could be located 15 minutes in one direction, but another 15 minutes in the other direction. The idea is that by paramedics and fire rescue seeing this, hopefully they'll take your loved one to the hospital listed. If they do take your loved one to a different hospital, perhaps the doctors and medical staff in the emergency department, upon seeing this, will understand that your loved one already has a connection with the other hospital and will call over to that particular hospital to obtain any further information as needed. Below this, write primary doctor, followed by a colon. Write the doctor's full name, title, and telephone number. The doctor's complete address, along with their name, title, and telephone number, will be listed on your loved one's medical history papers inside the envelope. Next, write contact person, followed by a colon. If you're the contact person, write your full name, and underneath in parentheses, write your relationship to your loved one, such as daughter, son, daughter-in-law, son-in-law, etc., followed by your telephone number. If there is more than one contact person, list them as well. Just repeat the process. Continuing downward, write allergies, followed by a colon. If your loved one has no allergies to medication or food, write no known allergies. If they have allergies to certain medications, foods, or other items, list those particulars as found similarly listed on your loved one's medical history papers inside the envelope. Following this, write falls, followed by a colon. If your loved one has previously fallen on several occasions, write multiple fall history, and if they haven't, write no prior fall history. At this point, we're going to take another short break, so please stay tuned and thank you for watching.